Are you freezing a little bit? Is it cold? Yeah, no worries. Yeah, we will do a fantastic warm up in a few minutes. So, yeah, stay tuned. Hey, my name is Chris Wiebe. I'm head of WASH programs at Viva Con Agua, and I have the honor to moderate this session with this beautiful title: Beyond Language Borders: WASH System Strengthening Through Sports, Arts, Music, and let me add, dance. To put it in the words of Kamala Harris, dancing in this session is not required, but very much appreciated. Today, we will dance deeper into the future of sustainable WASH services. Despite numerous health promotion approaches developed over the past few decades, achieving sustainable behavior change in WASH practices remains a significant challenge. Research shows that participants often revert to unhealthy and disease-promoting behaviors, such as inadequate hand washing after a project's completion. So, how do we create change that sticks? Let us enter the Universal Languages for Behavior Change, UL4BC, an innovative program that leverages the universal languages of sports, music, and art to foster positive, lasting behavior change at micro level. Welthungerhilfe, Viva Con Agua, and IRC WASH, and some special guests, we'll come to them later, will share their experience and lessons learned on how these positive changes can be scaled up through system strengthening approaches, promoting local governance, community empowerment, demand creation, and establishing sustainable social norms for safe and healthy WASH practices. Before we get into the agenda, I would like to take this moment and return to the beginning of this World Water Week, to an innovative approach that has been tested throughout the week, starting on Monday, with a joint workshop from Viva Con Agua, German toilet organization, Splash, and One Drop. My dear colleague Belinda Abraham hosted this lively session, and yeah, it was called the Generation WASH session. What happened there and in the follow-up during the week? Belinda, the stage is yours.
Thank you. Woohoo! I must say, we had a fantastic weekend, as Chris has mentioned. Thank you. First, I want to thank you all for being here. It's Thursday, the end of the conference, and still the energy and motivation to be here today, so we're really thankful. And for those of you who participated on Monday, as Chris mentioned, Viva Con Agua, Splash, One Drop Foundation, and the German Toilet Organization held a workshop, and we had the objective to build a behavior change campaign using elements of UL4BC, so Universal Languages for Behavioral Change. We'll talk a lot about that later. Within this CWE community, to see if we could break down borders and boundaries and have people reach out. So I don't know, maybe you saw people going around with this orange tag, but basically we went through a number of activities to build this campaign. And I would say, so we started with some activities very briefly, the Whys of Why tool, which was done under the Toilets Making the Grade, which was done by German Toilet Organization. We also did a creation by One Drop, and the scaling up, scaling out, and scaling in by Splash. And so our call to actions, there were many, but I think I'm going to choose maybe 3 or 4 of the ones that I really liked. So the call to action to get us to come out of our boxes. One of them was WASH, hashtag wash away privilege, yeah, hashtag wash my ego, hashtag this one, hashtag keep it simple stupid, let's kiss, and then hashtag more than my badge. And the whole idea, again, was for people to connect, and I was very pleased to see throughout the week people actually doing that. And I think personally myself, I also felt that I was more motivated to connect. But again, to share that simple approaches for fun and joy can actually bring meaningful connections to inspire, to motivate, to inspire, to connect us, and to transform. So with that, I would then like to invite Rushika Shiva. She is with IRC WASH, based in Delhi, to say a few words. Thank you in your presentation. Thank you.
Thanks, Belinda. Um, I'm just going to set the scene with respect to looking at behavior change from a systems lens. We'll be getting into more about the interventions in various contexts, India and Uganda, and the experiences in these areas. So, our experience in India, but also in South Asia, has been that infrastructure alone cannot help us reach services, with especially safe services. There are a lot of Indian programs that have happened, but also other programs, grant-supported projects in Bangladesh, India, in Nepal, but they have not guaranteed the use of these infrastructure. So there's a lot of infrastructure created. Without the behavior change, there is no access to these. These are not used, and hence we kind of are at the same situation in terms of almost no service. Our experience also has been that one is having behavior change, and often that is placed at the beginning of programs, right, in terms of building demand. But that's not enough. And we'll also have the secretary from India talking about just having it at the start doesn't help, because with that we create demand, but if something breaks down, we are actually back to square one. Behavior change needs to happen with communities, but also with the duty bearers, and that needs to be a continuous process, because we're talking about cultural, social norms that are there, so even the duty bearers have the similar kind of norms. So with respect to systems, there are various factors. If you think with respect to communities, there's the private sector that's thinking about their products, services in their way. We also have issues with respect to water, accessibility of water. In the South Asia context, the toilet usage also depends on the availability of water. How is O&M actually catered for? How is it managed? How is the financing actually happening? All of these things actually make up to see, are these services actually accessible? Are they being used? And would they be sustainable? So we've just kind of put these factors in certain boxes, which we call the building blocks. And we know that the education system, because there's a lot of school-led sanitation, school-led wash programming that actually helps. We know that from various organizations. But also wash in healthcare centers, and also there are various other systems that are key and do influence the uptake of wash services and the sustainability of these services. Just with respect to focusing on demand and behavior and political will, like I mentioned, we need to work with communities in terms of changing their behavior, but at the same time, we need to work with institutions. So are they actually prioritizing behavior change in their WASH programming? Do they have the capacities within the institutions to be looking at it? Are they planning for it adequately? Do they actually cater for enough resources for it? If you don't have adequate capacitated human resource, we know from the large funding missions in India, a lot of the finance that is even put aside, which is often 5 to 7%, is actually unspent or used for things which have nothing to do with behavior change. So these end up being key when we're looking at changing behaviors of community, and at the same time looking at institutions. Who are the institutions planning for WASH? Are they adequately capacitated in terms of understanding what the community needs, cultural norms are, and to shift that? So those capacities within institutions is also key. In addition to this, if we look at other building blocks that influence how sustainable services can be, and behavior change playing a key role in that, if you look at infrastructure and service delivery, again, behavior change has a key component before, during, and in an ongoing way. Monitoring, we are often monitoring service levels. At some level, yes, the outcome shows in service levels, but somewhere we need to also capture the behaviors of the communities and the change in institutions. And learning and adaptation, I think even the intervention that we're going to talk about is often that we try something, we learn something, we need to come back, adapt, and redo it, because there will be no one-shot model. We know for the case in South Asia, at least, often IEC is understood, or behavior change is understood as information, education, communication, which is leaflets, wall paintings, or something which Even the officials are not interested in leave alone the communities. So that bit of cycle about behavior change needing to be in the center, learning from what's happening, what's being done, what is it that we can improve on, actually needs to happen and needs to be the core of it. I'm going to move to Arpana, who will give more of a grounded experience from India. She's with WHH.
Namaste everyone, I'm Aparna Lal and I'm from India. So we heard from Ruchika that behavior change is very important for WAS system strengthening. We also know that there are lots of other behavior change tools already in the market. So why we are talking about UL for BC today? To understand that, I would like you to hear the story of Ram Kumari. So Ram Kumari is a little girl from Madhya Pradesh, and she is also a player of football for WASH, which is one of the most popular tool of UL for BC, not only in India, but also in Africa. So a few months to the program, and she got very disturbed because she learned about the toilet hygiene in her school. And under a government scheme, a toilet was also built in her home, but nobody ever used it. Now it is completely broken beyond repair. So she went back to home, questioned her father that why we have never used the toilet. It was there. And now I know that open defecation is not good. It creates diseases. It also leads to soil and water contamination. Now what are we going to do? There is no toilet. Just build a toilet for me. But she is a little child. Who is going to listen to her? Nobody listened to her. But did she give up? No. She is a persistent soul. She kept pestering her parents that build a toilet, but still nobody was listening to her. So the first moment we started folk art for WASH program for the community, she made sure that her parents are there. They are participating. So what happened? The multiple level of information actually ultimately changed the perception of her parents. And now you can yourself see she is just in front of a newly built toilet. So yeah. Now, okay, then now we need to understand why UL for BC succeeded where other programs failed. So there are lots of differentiators, but I want to focus on only 3. The first one is that we don't believe in one-time campaign. We actually create small activities and we do it over the months and over the years and building on layers and layers of WASH messages. And this actually showed us result. Second is that we don't believe in shaming, guilt, fear, punishment, no. We actually take inspiration from the emotions of joy and fun. So what we do? We use games, we use local art, we use dance and music. And it has 2 advantages. The first thing is that it attracts people easily. So you just get a low entry point with the community. And second is that people don't even understand, but they are soon deep into the issue and they understand the issue. The third thing is that we are not going anywhere and just building toilets and then we are talking about just use it. We try to create the demand bottom up. So we first create awareness, let the people know that these are the issues, and we want them to create the solutions. And so the demand comes from the community itself. And once the demand comes, it is very difficult for the local authorities or local systems to ignore it. They have to take the notice. But we don't do it randomly. UL for BC has a structure. We start with activation, where we just do interesting activities and people are interested in us. Then we do go for inspire, which is deep into the matter, a lot of WAS messages, a lot of practice, and then people actually understand that this is the problem, and now they should find a solution. Then we come to third stage, which is connect, where we don't only connect with the community, we connect the community with the local government authorities, village governance system, and we also go to the national level, we activate youth, and then we also create lots of festivals and youth outreach programs, and we try to bring the people from all levels together for the final transformation phase. Now, what we have done in the past 2.5 years in India, as you can yourself see, we have reached out to 500 children directly. It was a pilot project, so it started only in 16 villages. Then we worked with 5,000 households directly. We also worked with a lot of artists, 500 artists. Then we did a Voice for Change youth outreach program in universities and colleges, where we did stories, we did poetry on menstrual hygiene, on water conservation, on water scarcity. And this made a lot of ripple in these universities. We are getting volunteers. And last but not the least, we also reached out to people, 80,000 plus people via digital media. So that was amazing. You heard about UL for BC. You yourself see how we do it. So in the last part, I would like to talk about the impact we achieved and also some challenges. So we have recently done a midline survey by an external expert agency. And what we found that over 90% of our direct beneficiaries have showed immense knowledge about the WAS practices, and they are actually trying to implement it in their day-to-day life. Even the indirect beneficiary, around 60% of them are already sensitized and ready to go to the next level. Then we talked about creating demand at the bottom. So now all the schools where we are working and also in the villages, people are actually going to the village head and demanding for better roads, better drains, better drinking water facilities and toilets in schools. And lastly, the thing is that because it is a systems strengthening approach, we work with government officials. And most of the government officials know about our program. They very much appreciate the program, and they have shown the intent to scale it up. Now, actual scaling it up is an issue, and we'll talk about that. But before that, I want you to listen to the government testimonials from ground.
मैं सीओ जिला पंचायत के रूप में पिछले लगभग 1.5 वर्ष से देख रहा हूं। 5 स्कूल में लगभग 200 बच्चे से अधिक जो प्रतिभागिता करी है। एक फुटबॉल फॉर वॉश ये कार्यक्रम चलाया जा रहा है। उसके तहत पर्सनल हाइजीन के रिलेटेड गतिविधियां उनके द्वारा कराई जा रही हैं।
तो जो बच्चे स्कूल नहीं जा रहे थे, तो वो खेल के चक्कर में स्कूल जाने लगे और स्कूल में का प्रवेश एकदम से बूस्ट हुआ, बढ़ गया बच्चों का। तो बच्चे पढ़ लिख रहे हैं। तो जो खेल के माध्यम से जो बिहेवियर चेंज की बात आप लोग कर रहे हैं, वो ये बहुत अच्छी बात है। जो अभी 5 गांव में जो फुटबॉल फॉर वास चलाया जा रहा है, इनमें भी बच्चों में बिहेवियर चेंज आया। हाथ कैसे धोना है, हाथ धोने की महत्वता को वो समझ रहे हैं और अपने किचन गार्डन, पेड़ लगाना, इन एक्टिविटीज़ में भी वो अच्छा काम रुचि दिखा रहे हैं और अच्छा काम कर रहे हैं।
जो ग्रे वाटर हमारा वेस्ट जाता था, तो आज हमारा समुदाय उसको ग्रे वाटर को अपने किचन गार्डन में उपयोग कर रहा है।
इस प्रकार के कार्यक्रम अगर अन्य स्कूलों में भी आयोजित किया जाए, इसमें प्रशासन का भी सहयोग रहेगा। और मैं ये चाहूँगा कि हमारे ज़िले में जो आप कार्यक्रम कर रहे हैं, कार्यक्रम के माध्यम से विकास का बच्चों के अंदर जो भावनाएं भर रहे हैं, वो सुदूर ग्रामीण अंचलों में भी जहाँ पहुँच मार्ग नहीं है वहाँ तक ये बात पहुँचे और सभी लोग स्वच्छता का ध्यान रखें, है ना। पानी बहुत ज़रूरी है, पानी जीवन है, ऐसा पैगाम बच्चों के तक जाए और बच्चे उसको समझें।
Yeah, so yeah, in the end, I want to say you that we have the evidence about UL for BC, that it is effective, and we are trying to scale it up with the government, but there are challenges of permission, finance, and also bandwidth, but we are very hopeful. So now I would like to invite my colleague, Barna Namwanji from Uganda. Over to you, Barna.
Yes, good afternoon, ladies and gentlemen. Oh, thank you. Good afternoon, ladies and gentlemen. My name is Bana Namwanje, and I work for Viva Konagwa in Uganda. Apan has already shared how they use UL for BC in India, but I would also love to show you how it's done in Uganda, right?
You know where we come from? Before you do anything, you have to wash your hands clean. Let's go! Shake it, wash it, break it, make it, shake it, wash it, break it, make it, shake it, wash it, break it, make it, shake it, wash it. Kili my bello, amasige wafe, bowoli la gayeka, boli chimochi wede. Kili my bello, amasige wafe, bowoli la gayeka, boli chimochi wede. Now me and you together, let's check it, brother, sister, shake international. Wash it, all we need is soap and water. Let's wash them now. Break it. Break it, break it, break it, break it. I wanna see you make it, make it, make it, make it. Shake it, wash it, break it, make it, shake it, wash it, break it, make it, shake it, wash it, break it, make it, shake it, wash it. Let's go! International, wash it. All we need is soap and water. Let's wash them now. Break it, break it, break it, break it, break it. I wanna see you make it. All over the world, all over the world. Shake it, wash it, break it, make it, shake it, break it, make it, shake it, wash it, break it, make it, shake it, wash it. Let's go!
Benjamin Adrian, one of the founders of Viva Konagwa, once said, as Viva Konagwa, we cannot solve all the problems of the world, but we can learn to dance with them. As you can see, in Uganda, we took this statement very personal, and That right there is a result. We are using Dance for Wash, what you've seen, to challenge young boys and girls in schools to create dance routines which they can use to show their peers how proper sanitation and hygiene could look like. But away from schools and communities, away from the young people, we are working, we are working with the district local government in Uganda to also use the UO4BC approach. And I would like to take you on a journey to Toroko district, southwestern Uganda. It's really far, but we'll make it. And there, I would like for you to learn about how the district local government is using UO4BC.
I'm Mumbere Nason, Assistant District Water Officer in charge sanitation in Toroko District, Western Region, Uganda. I'm here to give a milestone on water services in Toroko District. As an institution, we are using the universal language approach to achieve the system strengthening by working with various visual artists to create murals which communicate to the communities in their roles in achieving better wash services. We have murals in Karugutu, Kanara Town Council, Wefsengo Town Council, and they have played a big role in disseminating the different feedback mechanism, and we want to extend these murals in other administrative units like Bweramule sub-county, Websengo sub-county, because people respond positively to these murals. The drama group, they have done skits to educate communities on their roles and responsibility, and how they can give feedback to the district to make the human rights to water and sanitation a reality.
Yeah, to add on the voice of the district of government and to share some insights on what has been done so far. UO4BC has been used to engage communities on their right to wash services. Majority of the people in Uganda, and when you go deep down to the local villages, they don't know that it is their right to have these wash services. So through the songs, through murals, through comedy, drama, we are engaging the local people in the villages to know that it's their right, first of all, to have wash services. It's their right to demand for the wash services, and also to reach out to the district local government if they don't have these services. And this approach has also been used to connect wash service providers, the Wash Service Authority, which is the district local government, but also the users of the wash services. And what is most important is that this approach has been used, as you've seen in the mirrors, to gather feedback from the locals about the services that they are using, and also to give feedback to the district about their performance. Well, beyond that, and what we look to use UO4BC for in engagement is that we want to use it as a powerful tool for community mobilization. As you can see, it has the power to bring people together. So to discuss issues around sanitation and hygiene, it has been a very good entry point for stakeholder engagement. And through sports, through music, through arts, we are able to talk about the different issues among the different stakeholders at all levels. And it's been a very powerful tool for inspiring all collaborators at all different levels. Well, it's not all sunshine and flowers. There are also some challenges that we have. And the biggest one, and what we are struggling with, is packaging UO4BC to actively engage stakeholders at macro level. Stakeholders are like government officials think most of the times these are just recreation activities, which is not the case. For us, we see sports, music, and arts as one of the powerful tools for development. Yeah, and beyond that, tracking adaptation after UO4BC interventions is still also a challenge for us. When we look at the lessons that we see from the communities, it's always hard for them to adapt, and it's harder for us to track what they are using UL for BC for after that. But with challenges, there also comes opportunities. And one of the opportunities that we see is that UL for BC contributes to many of the 9 building blocks. It's a very powerful tool for resource mobilization. It's a very powerful tool for stakeholder engagement. It's a very powerful tool for community mobilization. It's also one of the tools that we are using for bridging the communication gap between the stakeholders, between the service authority, between the service users, and the service providers. And last but not least, UL for BC is a very powerful tool for inclusion, connecting all service users, connecting people in the communities, and which would include the youth and everyone. So, thank you so much. Now, I would like to take you through one of our UL for BC drills. I don't know if you're ready to actively participate. If you are, please leave your seats, put the chairs back in, tucking them in, find some space wherever you are. Do we all have space wherever we are? Yeah. We all know the sanitation ladder, do we? Yeah. At the lowest level, we have open defecation, but we are all going to assume we are past that, right? Yeah, but then we also have the limited, the basic, and the safely managed. You know, we have the unimproved, the limited, the basic, and the safely managed. Yeah. So, okay. So that level where they are right now is going to be the unimproved. Okay, and then go a little bit higher, that's the limited. Okay, and then a bit higher, yeah, that's the basic. And then when you are standing upright, that's the safely managed, okay? And what is important is that we are all going to try to strive to reach to the highest level, okay? No one wants to be at the lowest level, okay? And what we are going to do a rock, paper, scissors game. Rock, paper, scissors. Whoever wins makes it to the next level, okay? And whoever reaches the highest will be the winner. So wherever you are with the space you have, you are going to go down, everyone, find someone in the room, do rock, paper, scissors, move to the next level, okay? Yeah. When you progress to the next level, you find the people on your level, okay? If you're on limited, I was going to we are not done with the drill.
We are not done with the drill,
yeah.
but during the drill, we want to, set up the stage for the panel.
Okay.
Yeah?
Yeah.
Because I think it works now.
That's the mic.
Okay.
You can remove this.
Oh no.
Yeah. Are there people at the safely managed level? we have to keep going around. So the game is not over. How it works is that if you're unlimited, you go and look for people at that level. You don't do rock, paper, scissors again with someone who is on the... Because you don't have the same challenges, yeah? If you're unlimited, you find people at limited and you do the rock, paper, scissors so that you can progress. Can we try again? Yeah, so we all go down. We start at the unimproved, yeah? And then when you do rock, paper, scissors with that person, and you go to the next level, you look around in the room at who is at that level, and you do rock, paper, scissors with them, yeah? Yeah, so you're not doing rock, paper, scissors with the same person. Yes. Can we try again? Are we ready to try again? Yes? I don't hear you. Are we ready to try again? Yes, come on. Yeah, well, let's go. Yeah, so if you progress, you look for someone who is at that level, and then you do it with them. Yeah. Okay, thank you so much, ladies and gentlemen. Thank you so much. Now, I want to leave you with two questions. Two questions. If you were stuck at some level, how did you feel about that? And during the game, that's the first one. The second one is that, frustrating. Okay. The second one is that, how can you relate what you were feeling to the situation in your communities when it comes to access to sanitation? Yeah, this is for you to reflect on. For now, I'm going to hand over to Chris again.
Thank you, Berna, for this fantastic session. And now I hope, it has got a bit warmer here, a bit hotter in this room. And so thank you for being so active. Now, I need, all right, I have a microphone, that's right. Yeah, now I have two, I love it. Okay, we start now with a panel discussion. I would like to invite you, Aparna, Berna, to the panel, Ruchika, and also the special guests I mentioned in the beginning. So we have here Dr. Ula Ganathan Perumal. He is Secretary of the Water and Sanitation Department in West Bengal, India. Please take a seat. And Davina Cochrane, she is a visual artist based in Hamburg, Germany. So, dear Ruchika, a system, as per definition, comprises all the actors, that is, people and institutions, factors, that is, social, economic, political, environmental, and technological, and the interactions between them that influence the achievement of universal, safe, sustainable wash services. When we look at the building block of behavior change, that includes also demand and political will, what are the most important actors and factors that must interact to sustainably anchor lasting behavioral change in a society at scale?
Thanks. Thanks, Chris. I think I'd already touched on some bits of it with respect to the importance of planning for behavior change, finance for behavior change being key, but also in terms of the institutional capacity and the arrangement. But just touching on the institutions, we often, being WASH organizations, tend to go to the departments responsible for water and sanitation. But we clearly know that where we have other interventions say in schools and all, we need to be working with actors beyond just the wash department. We need to be working with the education department, other local governance departments also. But in addition, looking at, like I mentioned that, and sir will probably talk more to that, the traditional behavior change efforts or attempts that happen by government end up being fairly boring. And that's where a lot of other actors can play a role, whether they're academicians, people working on mass communication, or those who are working around marketing related bits. That those are organizations or NGOs that are working more on communications with on behavior change. Those are the different actors that need to be brought in. So yeah, that's my experience. And we talk about the building blocks with respect to having just some bit of a framework to the complexity on the ground. But when we go on ground, working at the state or district level, we typically don't talk this language, but it helps us to kind of plan our interventions. Yeah.
Mm-hmm. Okay, thank you, Ruchika. We come to Dr. Ulaganathan. So what, in your opinion, is the importance of behavior change communication initiatives? And in your experience, what has worked well and where did you face challenges?
Thank you. First of all, thank you for inviting me here. I have worked in the field for more than 10 years on sanitation and water. What I have seen is that any government program without community participation and community ownership doesn't succeed. Sustainability is not even in the question. It doesn't even succeed. So we have seen it that the behavioral change is vital and fundamental for any government program. So that's what Government of India has adapted in all the programs nowadays, whether it is Jal Jeevan Mission or the Swachh Bharat Mission. So effectively, community has to own it and it has to adapt it and they have to participate. That's what is my experience. I worked in the field for more than 10 years, gone to the nook and corner of my district. And I've seen people get very jubilant when they get involved in the program. If we do the supply-driven approach, half of it reaches and many are not utilized. So if it is demand-driven and community-owned program, we have seen tremendous success. So that's how it has been. So we have seen all the toilets built in everybody's house now. People are using it and clean potable water has reached all the villages. So it has reached far-reaching effects. So now Government of India has adapted in policies also, framework also in all the governments, not only sanitation, water, health, women and child development, in all the schemes now, community ownership and participation has become fundamental in policy making.
Mm-hmm. Okay, and what would you recommend that needs to be done so that behavior change communication gets more attention at policy and policy implementation level?
See, we have to, in fact, the unfortunate part of it is that most of the government officials themselves not sensitized about behavioral change. Very bad indeed. In fact, everybody loves to do the supply-driven approach. Just give a target and try to achieve it. It doesn't work in the field. Unfortunately, the service doesn't reach. So the first and fundamental thing is that field-based feedback have to be collected before making the policies and formulations. During implementation, a lot of people innovate a lot of things. Those things have to be documented. And finally, policy decisions should be taken. So it has to be from the field to the topmost authority who takes the decision. Otherwise, simply putting targets and making certain programs is not going to work. Thank you.
Okay, thank you. Okay, we stay in India, yeah? So please hand over the mic to Aparna. Yeah. Through your work with communities and schools in India, you have found that essential behavioral change, such as hand washing, can be communicated much more effectively through arts, sports, music, than through traditional hygiene promotion approaches. Yeah. So how relevant is UL4BC in the Indian context?
Yeah, so Chris, as others also said, in India, there is no dearth of intent or the schemes. We have a lot of schemes in India and a lot of money is also going into these schemes. But where these schemes fail is that they never incorporate behavior change since the very beginning. It's like a one-time campaign. You do some movies, you do some songs on moving vehicles, you do some wall painting, and that's it. But it doesn't happen like that. So why UL for BC is so important? Because it gives the onus to the community. We focus on creating the bottom-up demand. That first you let the community know what are the problems, and that is also very interestingly, that they are not knowing that we are teaching them something, but they are actually experiencing and enjoying that and then understanding. So that demand, when you build something after that awareness, then it is more powerful and it is sustainable. So I believe that we have a lot of scope of UL for BC and also various social art, behavior change communication. And we feel that if this kind of approach is taken since the very beginning for all kind of programs, then it would be successful. And none of us can deny that fun and joy is always motivating. So for me, there is a long way to go. Thank you.
Okay, thank you, Aparna. To play now a little bit of ping pong between the two continents, yeah. Berna, what are the measurable success factors of behavior change communication through sports, especially football, in Uganda, and how do these differ from conventional methods?
Well, in Uganda, behavior change communication, and especially through sports, and to refer to our Football for Wash program, has proven to be successful among the youth in changing beliefs, in changing behavior and attitudes. And some of the notable success factors around knowledge and awareness, I would say. We can always measure change in knowledge and attitude among participants. Recently, and not recently, but years ago, we conducted a survey, an assessment with Makerere University professors, and some of the findings was that children in school who had participated in our Football for Wash program were 7 times more aware about proper hygiene than their peers who had not participated. And when you think about sports, and to answer your question about how it's different from the conventional methods, you find that sports has the power to create an engaging and interactive environment when it comes to learning. Some of the approaches are always one way, keep feeding knowledge. But when you look at sports and how dynamic it is, it has the power to bring people into this interactive, fun environment. When it comes to the other success factors, one I could think about is engagement and participation. We always track how many of the participants come to our workshops, our Football for Wash workshops, but also how many stay in the workshops, and this is very important. And when you think about what sports can do in this regard, is that it has the power to attract diverse groups of participants, even those who would not have made it if it wasn't sports related. Yeah.
Okay. Yeah, thank you for making the Ugandan context more tangible for us. So, yeah, Davina, since 2017, you're working closely together with Viva Con Agua. In 2018 and 2019, you joined the Viva Con Agua wash team down to Uganda to paint murals and hold art workshops with kids in over 30 schools. Your murals bring wash messages to life in vibrant, meaningful ways. How do you find the balance between artistic expression and the educational goals of the murals?
Well, I think that's an easy question to answer because art is a universal language. There is no language barriers. We all connect to art. It doesn't matter where you're from. So art can have an impact culturally, it can have an impact educationally, and I mean, nearly every person can learn the best through imagery and through emotion. So art connects the both of them. So I think that's a short and easy answer there.
Short and crisp. Keep it simple, I would say. I can underscore what you say. So, okay. But I won't leave you without another question. So what inspires your designs, and how do you ensure they resonate with the communities you're working with?
Yeah, so we work with the communities really close. That's what we did when we were there. I can tell you a story about about the situation, how we work with the communities. So when I was in those 30 schools that you were just saying, they have these signs that are stuck in the ground, and they help the kids be reminded of washing their hands when they use the toilet. But you know, there are only like black letters on a white sign. And I was like, guys, this is boring. Kids don't resonate with black letters and black font on a white sign. So then and there I came up with superhero characters, that we call them the wash heroes. You can see on the manuals that are on the tables, you can see them in there, the little cartoon characters. On the back you can see 2 of them as well. We came up with them to have a child-friendly and fun way to educate kids and bring it more into a heroic perspective. I mean, we all love Marvel characters. We can resonate with the look and the feel of what they do with their messages. So yeah, this is where it started. So we went to all the schools and we changed the signs to make them more colorful, to bring art into the whole school environment. And now we printed a lot of manuals. We handed them out in school libraries in many different countries in South and East Africa. Yeah, this is the one I can hand it around. I only have one with me today. This is a whole cartoon book, like workbook. We did an animation film. Like, it kind of went everywhere. Like, it was a really fun project that is still growing and still going in different countries. And we're adapting those characters as well. We did Indian versions for them as well. So yeah, and with the murals, I mean, we're working together with the locals with the murals in some cases. I mean, one of the murals was really high up. I can't take locals up there. But yeah, we work with the kids. They help us paint the walls. And again, it's a sort of like thing that we do together, and it's a community thing. And we work together with local artists as well, so we collaborate, and it's just a message we can spread everywhere, and it works for everybody.
Mm-hmm. It's collective action, and and every child can be a wash champion, yeah?
Oh, for sure. Oh yeah, I know the story how they saw the signs and we changed them in the schools, and then they sat down and no one told them to do that. I was just like, people were tipping me on the shoulder, look over there. And I'm like, what? They were just taking their coloring stuff and just made their own versions of the wash heroes. They started adapting and trying to create their own versions of their own superheroes. That was so cute. Oh my God. Yeah.
Thank you, Davina, for those inspiring examples. Berna, can you discuss the role of community leaders and local influencers in the UFOC context, and how they contribute to the success of WASH initiatives in Uganda?
Thank you, Chris. When we talk community leaders and local influencers, they come in so many ways. They could be the village chiefs, they could be the religious leaders in our communities, they could be the teachers, they could be the artists like Davina, and all the children, all the people who inspire children. Now, they are an image of trust, first of all, in our communities. When we see them, we tend to trust because they are our role models. We tend to trust what they have to say, and usually their engagement in our programs, in our UL for BC programs, is always like an endorsement to the program. And the other thing is that we look up to them for contextual and cultural understanding, especially the religious, the village chiefs, for example. We look up to them because they understand the cultural norms of their communities. And usually when you go into a community, you want to already make some research. You cannot go, for example, with our Football for WASH program, we always tend to struggle in communities where they believe girls should not participate in sports. And when we go to these communities, we want, first of all, to reach out to the cultural leaders there, because they have this deeper understanding. They always share insights on what is acceptable in the communities and what is not acceptable. And if you want your programs to succeed, you have to have them on board, and they have to always reach out to the people. But One last point is that for ownership and sustainability, you have to go to the local leaders in the different communities. You have to look out for the local influencers, because when you're not there, they have to be the ones who take the program ahead. And for that reason, we do a lot of capacity building for local leaders in communities on our UL for BC approach on Dance for Wash, Art for Wash, because we want them to own this program and be able to take it forward when we are not there. So that's basically the huge role that they play in our UL for BC programs.
I can add on to that, if that's okay.
Yeah, okay.
We had this influence, you said about influencers to get them on board. It's a big thing. Like, we had this huge artist who's well known in Southeast Africa. His name is Zex. And he has a big impact. He has a big social media following. And to get these kids on board as well, who have a big impact, who are influencers in their art, like musicians, artists, they have a big fan base. And just to get them on board as well, that has such an impact as well through art and culture, yeah.
Mm-hmm. Yeah, that's a great example. Thank you. Okay, coming back to you, Ruchika. From a policy perspective, what are the key elements needed to integrate innovative behavior change communication practices, like sports, music, and art, into national and subnational WASH strategies? And how can governments facilitate this process?
So I think in the policy perspective, just touching upon the ones that we have for water and sanitation, they broadly provide a bit of a guidance as to what can be done, and they have budgets there. It's the policy implementation which goes down to the districts, and some suggestions at the state, which are the subnational levels, that can be provided. So it's sharing what the progress has been, what the intervention is, what the progress has been. It's also important to cost the intervention. How much does it cost the government? Because in terms of finances, also in terms of human resource, that is something that the government would be interested in. If they have to scale it up, what actually is required for it to be scaled up is often the interest of the government. So that is something to be mindful of. How would it actually play out if it has to be done on scale? So that is a bit of information that needs to be shared in addition to what the impact of these interventions have been with the state and at the district level. There are funds for behavior change for in the mainstream missions, but also with respect to WASH in institutions, so with respect to schools. Yeah.
Mm-hmm. Dr. Ulaganathan, maybe you want to add something to this?
Yeah. At the government level, what we have seen is a lot of limitations are there, particularly, like she said, funding is one of the issue. But apart from that, when we go for implementation, we see a lot of problems. India is a country, huge population, lot of variety in culture, language. So you have to adapt to the situation, and the district machinery, the local leaders, the political leaders, everyone have to come together to make it success. So implementation is ultimately what it matters. So policy, whatever it is done, these are just general guidelines, but during implementation, you have to go into nuances, innovations, then proper funding, capacity building, and take the entire event to a great public movement, big campaigns. Mm-hmm. There the communication strategies work great wonders. This universal language for the behavioral change is what actually matters at the ground level. So we have to develop to different cultural identity, different regions. We have to have separate kind of approach. So it's a tough challenge, and if you don't do properly implementation, then the entire thing collapses. So government officials, political leaders, and the community all have to come together to make it a success.
Yeah. Okay. Thank you. Now, yeah.
I just want to add it in. Yep. Add one bit in. For 24/7 water, we've done this in Odisha in terms of having a communication strategy for water, but that too there was still a broad document. Yeah, at the subnational level, you need to make it more relevant to those to the districts, sub-districts, because it's a mix of different kinds of population, which are tribal, non-tribal, and different things would work with these communities. So, yeah, So you could have a broad, in terms of system strengthening, look at least a strategy. So if there is that money that is there from the various programs, a certain percentage of what the funding is for that particular program, say Jal Jeevan Mission, if there's a 5% there for behavior change, then what is the communication strategy? And hence, what would that mean? So the focus is not on policy as much, but the implementation of is where a lot of the time and the resources need to go in.
Okay, thanks for the add-on. And the mic can move now to the other side of the panel again. Yeah, Aparna, how can integrating UL4BC within WASH systems help address systemic issues in India? And what examples have you seen being successful in India, but also challenging? So maybe 2 examples for each.
Yeah. So thank you, Chris. So basically in Madhya Pradesh, what we are doing is a pilot project. So we are focusing on 16 villages and 3 districts. And we are focusing on micro and meso level. We are not going very ambitious and starting with the national level. So we started engaging with the schools. That is one of the systems. Then we started with Panchayat, which is the local government's governance system of every villages. Then we went to block level officials and district level officials. So we started engaging with them. First, we invited them to the schools and make them see the Football for WASH program. Then we also engaged with Aravani Art Foundation. They work with transgender artists, and we painted 5,000 square feet of walls with WASH messages, and we created comic books and other things. So we always kept the government and all the systems informed about all the initiatives. That was the first step. Then we started with creating WASH clubs. And we created 2 kind of WASH clubs, first in schools with kids and also with adults in the villages. There they discussed all the issues which they had in the villages, and then they tried to do a dialogue with not only the village head, but also block level officials. And then the interesting things started. What we saw in school, that attendance rate increased high, very high, multiple times, and the government officials can vouch for that. After that, what we saw, that there is no budget for sanitation workers in the school. It is a lump sum budget, and that is that without any head. So when the community and also kids started demanding, then now principals have to give money for the sanitation worker. So that is also another change. What we also saw, that the WASH clubs we are creating, so as also mentioned about the Jal Jeevan Mission JJM, under that in every village we need to create a village water and sanitation committee, which is VWSC. So in Chhatarpur districts, they are still doing it. There are no VWSC. So what is happening, because our WASH clubs are so well aware that they are automatically turning into VWSC committee. And lastly, for the successes, I would also like to talk about that. In Panna district, the district CEO, he has asked us to submit a plan for 100 villages. And then, as Ruchika said, that they already have the fund. So under the SBM and other school funds, they are going to fund it. So we are working towards that. Coming to the challenge is that intent is there, fund is there, but the actual process, taking lots of permissions, the bureaucracy, and also capacity building of the team is really difficult. And again, we are working towards that. Thank you.
Okay, thank you, Aparna. And now we are moving again. Dr. Ulaganathan, the system strengthening approach is known for its connectivity between actors and factors, as we discussed in the beginning of the panel. So how is your experience in working across sectors on behavior change with so many different departments like school, healthcare facilities, etc.?
See, the government of India has learned over 70 years that many programs have failed in different sectors, particularly school, health, and women and child development, primarily because of the packaging of the programs as well as the implementation at the ground level. Many times the programs are forced on the people, and unfortunately during implementation they had fizzled out. So nowadays, what is happening is that the behavioral communication and rural participation has become a built-in process of every scheme being implemented now. So this has actually ensured the service delivery at the grassroots level that I have seen in the field. So now a lot of investment is being made on planning and implementation and communication involving the community. So a lot of digital intervention has come in. So at present, the implementation has been better. In the last 20 years, I have seen that things have improved a lot. So particularly in school education, a lot of students involvement, children involvement has become pivotal in implementing the projects. In women and child development, we have seen, we have a lot of self-help groups in India, where more than 10 women come together and they make a group and they decide what they want to do. So they have become part of the implementation process and government is engaging with them. Similarly, local sports clubs, the tribal groups, so religious group, everybody now they are coming together. So ultimately it ends up in the grassroots oriented approach and behavioral oriented implementation process. So this has changed totally the outlook of how we make the policy and how do we take it to the ground level. So now the things have improved. Now we are also as a government official enjoying implementation because we see the results in the field. So that gives a lot of satisfaction.
Okay, thank you. I mean, you already mentioned, some examples, but do you have any more suggestions how to ease this process, and to cross the silos where we're working in effectively?
Yeah, like I said, that we have to take out, the feedbacks and the experience at the ground level, take it to the higher authorities and the political leaders, the decision makers, and the process has to be reversed. That's what I have seen. Me as a district collector and district magistrate, I used to travel to nook and corner of the district. During sanitation program, I used to carry the football and cricket bats, and I went to the schools and locals. I used to distribute, and I have seen the things have improved in those districts. Simple one football has made the entire village totally, open defecation free. I have seen this myself. The children, they used to wake up at 5 o'clock in the morning. They will take the whistles. Whoever does open defecation, they will start whistling up. Then, like that, the awareness spread so beautifully in the district and the entire village became ODF. So, I have seen that the grassroots level intervention is absolutely important. Sitting in the air-conditioned room and making policies no more is going to be, viable.
Great. I mean, this is a really great example. It's striking how simple behavior change, communication can be. Berner. How do you measure the long-term impact of your 4BC activities and WASH practices?
Well, measuring long-term impact of your 4BC activities is quite a challenge, but I think we can approach it with both qualitative and quantitative methods. Recently, we conducted, together with the university professors from Makerere University, we did an assessment for the approach, first of all, and this was a couple of years ago, but we thought we could do a baseline and an end line to measure knowledge, attitudes, and practice, first of all. So this was one of the ways to measure long-term impact. But if you also add on periodic assessments after 6 months, 1 year, 2 years, you can still try to see and measure what new practices have been adopted over the long run, yeah. But also focus group discussions in communities and interviewing key informants on perceptions of the approach and how they feel about taking part in the activities and what they actually learn is very important. And I would say a combination of these approaches can help you to measure long-term impact, I would say.
Okay, thank you. We are coming closer to the end of our panel. So I think there's a lot to digest, and yeah, maybe also kind of wrap up what has been discussed, what has been told. So yeah, I would like to hear from everybody of you. Are there any key reflections you would like to share with the audience? And who wants to start? Who feels motivated?
Yeah.
Yeah.
So for me, we are in the right direction, I feel, and we need to work together with all the organizations who are in the same thematic area, and behavior change is the key, but we need to work with the government to scale it up because government has all the resources. So we just need to go in the right direction with force. That is my last word.
Yeah. And to add on what Aparna said, we know behavior change takes a long period of time. Therefore, I think for us to make it exciting, for people to be to learn about behavior change, it has to be playful and fun. Yeah, I think that's the way to go.
I think when it comes to art, I mean, which is my perspective on this whole thing, I would love to see more and more murals everywhere, more and more in the world, because that's going to be the most lasting impact, because they're going to stay there forever, and people can look at them and learn, and yeah, spread the word and get artists together. I don't know, just to be positive. I've seen what it done. Like I've seen what it has done with the people and with the kids, and the emotion it creates. So yeah, we need to get into that.
For me, I think it is to be sharing quite a bit of these experiences, but also not limiting ourselves to the district, but also the subnational level. So going a bit ahead in terms of sharing the experience, also the evidence that is required constantly to kind of influence the government about the importance and how it can be done. So not only flagging a gap, but also constantly sharing the solution and what's required to achieve that. Yeah.
I felt that the decision makers at the government level, they're very impatient. They want to achieve things very fast. As she said, the behavioral change takes time. So I feel that behavioral change should be a cornerstone of future policy and implementation, for which a proper partnership with the NGOs and the government and the decision makers, everything have to come together. Otherwise, succeeding everything, and in establishing sustainable result is very difficult.
Thank you very much. I think we've heard a lot of impressive experiences, insights, on which impact, behavior change communication can have, a lasting impact, and sometimes, of course, it takes time, but it can also be simple, and I think this is somehow the beauty of this Universal Languages program. So thank you very much. A big applause for our panelists. And now I'd like to ask my dear colleague Olivia, also a big applause for her, because she's the host of this session and co-organizing this. And do we have any questions from the online audience? Or if not, no? Okay, then there's a question. Okay.
Hi, you guys. I think it's really. I'm Keandra. I'm from the U.S. And I think it's really fun. I had fun working with you guys, so I imagine that they also have fun. All of the people that you work with. But I just wanted to know what sort of work you guys have done in terms of measuring the impact, because I know some of you had talked about it briefly, but just like how are you measuring it and how frequently, and where are you publishing that?
Do you want to start, Aparna? Yeah? Or is that a question addressed to somebody specific or to the whole panel in general? Okay. Mm-hmm.
So it is very difficult to measure behavior change in a very short period of time, but still we don't want to do it on emotions only, we want evidence, we want data. So whenever we start, we do a baseline. And then recently we have done a midline survey, and it is done by an external consultant who is an expert. So then we focus on both qualitative and quantitative, because quantitative gives us the highlights of the increase in the attendance rate, decrease in the school dropout rate. Then also we go to the parents, the community, and we ask them, have they seen any change in the behavior? Like if we taught about 6 steps of hand wash, are they doing it? Are they coming to you and telling you? So these kind of things, so focus group discussion, in-depth interviews, and then quantitative. So we are very much doing that. And we also believe in storytelling. So with time, after every, say, few months, we also do some interviews, which is done by the field team, because you cannot always do it by the external team. So we like to get stories of change. So when you compile everything, then you get a very good, direction that, is it effective, is it not? So that's what we are doing in India.
Yeah, and it's not far from what we do in Uganda. But what I wanted to add is that we already have a report from one of the assessments that was conducted. If you want, we can share with you this report. But when it comes to how often we do this, we strive to do it often, but also it requires a lot of resources to conduct assessments like this. But yeah, we already have some works done, and we can always share reports like this if you're interested.
Mm-hmm. From a government point of view, I'd like to answer this question. We have intermittent studies and third-party audits on all this. And we have conducted a different survey, how people are sticking to the sanitation practices. What we have seen times is that wherever the community-led total sanitation practices were followed, the percentage of people using toilets is quite high. And it has sustained over a period of time. And primarily, like, various communication methodologies were used. And in particular, the tribal area and the remotest area, we have seen the results are absolutely good. So there, the target-driven approach, it doesn't work. There, the behavioral change has worked. So as a government official, we have realized this. So definitely there is a great impact in the field, but it takes a lot of time. Initially, it takes a lot of time to really grind on this issue, but the results are highly sustainable.
Mm-hmm. Yeah. At first, thank you very much for the great question and the answers. Belinda, yeah, you go ahead.
I just wanted to add to it that one of the things that is very, very new that has started is working with Sprockler.com. Sprockler is about it's more of a storytelling generation, getting inquiries through storytelling. And so to capture, for example, people's experiences, so it uses like even mobile-based, where they can actually give and upload information, and then it's analyzed. And so that's something we've started very new. Other organizations, for example, like One Drop Foundation, have done a lot with it through the Social Art for Behavior Change. So it's something we've just started this year. A few, I believe, in Uganda were trained in the Sprockler. And so far, it's been very telling to just kind of watch the sort of the user experience, the journey, and try to capture that in really ways to tell the story authentically, and using opportunities. And the mobile-based kind of collection has been one way. So happy to share more of the early things on that, too.
Thank you, Belinda. Yeah, any more questions or remarks, comments from the audience? Okay. If not, yeah, I have to state we are pretty much stick to the time frame, which I haven't expected, I must say. Yeah, we will finally have a wrap up by Stefan Simon. He is coordinator of the WASH portfolio of Welthungerhilfe, and yeah, give us some reflections on the session, and maybe also what can be the next steps after the session.
Yeah. Thank you very much, Chris. thank you very much to everybody, and that was quite impressive. So, yeah, my name is Stefan. I'm working for Welthungerhilfe, and I'm coordinating the WASH sector from the HQ at Welthungerhilfe. Yeah, if you ask me, Chris, I think you can boil down the session to 3 key learnings. And the first key learning for me was more or less the rationale for the approach. They're similar to massive sustainability issues that we are having in water supply and sanitation, with dysfunctionality rates up to 30%. If you count also partly functional systems, we are up to 60%. So similar to that situation, we face sustainability issues also in behavior change communication. That's for sure. So if you take, for instance, hand washing practice or open defecation, CLTS approach, and the learning for me is, okay, we have to get better there, and we are not doing universal languages, not only to have fun, we want to be more effective. And the second learning for me is, if you integrate the universal languages approach, if you integrate them in your usual hygiene promotion activities, you can be more effective, more efficient, and as we learned today, also more sustainable. Definitely, we have seen successes. We've done piloting for years now in several countries, and there's definitely signs of impact. So that behavior change or good wash practice is lasting for a longer time. So there's evidence for that. There's no doubt. And the third learning that and the third takeaway is that it's now becoming feasible and also possible that we scale up to district level, and maybe in some years even to national level, to scale up the approach by combining behavior change with system strengthening, using system strengthening tools. That means, on the other hand, that we practitioners have to leave our comfort zone, definitely. No, it's not only anymore about hygiene promotion the usual way. So you have to engage more in advocacy work, in communication, in talking to politicians, also to other stakeholders, research artists, and so forth. And that is really a challenge, because we also have to think about different skill sets that we need for effective behavior change. And I mean, Aparna summarized the whole thing already. She said, we are on the right track, you said, and we have to work together. And that's true, collective action and combining all different approaches, what we learned through the last decade. That's very important. So my last word might be a question back to you, Christian. How do you want to follow up, or how does the team want to follow up this session? Is there anything planned?
Is there anything planned? I would say if anybody is willing to leave his or her comfort zone, so get in contact, with Behaviour Change, with Welthungerhilfe, and I think this is the next step we should do. So let's get in contact, let's exchange, and do something differently.
Yeah, super. And maybe we can call also the complete team which was involved in organizing the session to stage. Also Olivia and Belinda, please get up to stage. And a big hand from the online and the on-site attendees.
And with that, we'll close the session. Thank you very, very much for your patience.